Person-centered values are guiding principles that help to put the interests of the individual receiving care or support at the center of everything we do. There are 8 person-centered values you need to consider. Individuality, choice, rights, independence, privacy, dignity, respect, partnership, and encouraging decision-making of service users. For the exam, you need to know examples of how the person-centered values can be applied in health and social care settings by service providers. To ensure individuality, you need to always give service users choice, promote their beliefs, always put their interests and wishes first, and maintain their privacy. To give service users choice, they must be provided with up-to-date information so they can make informed choices, for example, about the type of care provided, and the options of care available. They must be provided with information about complaint procedures, and when necessary, they need to provide an independent advocate. An independent advocate is a person who supports and represents service users, to ensure their needs, wishes, and rights are heard and respected. They are not connected to the service provider, and work solely in the best interests of the individual, helping them make informed choices and speak up about their care or treatment. Service users have the right to refuse treatment, speak their mind, make their choice, to consent before care is provided, to be kept from harm, to respect, dignity and equality, and the right to private space and time when they need it. To ensure independence, service providers need to encourage service users to do things for themselves. This does not mean leaving them to cope alone, but empowering them to do as much as possible for themselves and agreeing to support them when they need it. Additionally, they can encourage them to make choices, and little tasks like making breakfast or making their bed if they are capable. One way to ensure privacy is by knocking on the door before entering a room. Another way is only sharing service users' private information if they give permission or if it's on a need-to-know basis for their care, safety, or the safety of others. To protect service users' dignity, you need to have an open and positive attitude. You need to take time to do things service users' way, don't make assumptions about how they want to be treated, and be aware of how personal care may affect their dignity. To respect service users, you need to respect their views, beliefs, opinions, and feelings, even though you might not agree with them. Also, don't be patronizing, and involve them in the matters that their care is concerned with. Working in partnership means working alongside other healthcare professionals, service providers, social workers, and their families, etc., to provide a coordinated, holistic, and person-centered care. A holistic approach means looking at a person's overall well-being, including their physical, mental, emotional, social, and even spiritual needs, rather than just addressing specific symptoms or problems. To do this, involve individuals and their family and work alongside other workers. You need to have good communication skills, build trust, and valuing and respecting what others have to say. To encourage decision-making of service users, you need to always give them choice, do not judge their decisions, empower them to make their own choices, and make them feel in control of their lives.